There's always a risk and benefit to doing anything we do in life, and medicine is no different.
With nearly 25 years of experience, Bon Secours Medical Director of Primary Care, Dr. Steve Newman, has helped treat a number of patients.
It's estimated that over 50% of Americans over the age of 65 are currently on 5 or more medicines, and 13% of Americans under the age of 65 are currently taking 5 or more medicines.
Dr. Newman says the reality is many people will be prescribed some sort of medication during their lifetime. Some will need more than others.
Taking multiple medicines is not necessarily a bad thing.
While a lengthy list may be concerning to some, doctors say that's not always the case as long as there are direct lines of communication between you and your provider.
I think it's very important that we always look at what we're taking and make sure that what we're taking is appropriate and necessary. But just because you're on multiple medicines does not mean that your doctor's doing or provider is doing anything incorrectly or that's not looking out for your best interest.
So, is there a limit on how many medications a person can take at once?
There is no number that's too much or too little, and the reason being is because you individualize the care of the patient based on what their current medical problems are. So it would be unfair for me to say that 8 medicines is too much, because in reality, if you have 8 medical problems that require medicines to treat those problems, 8's not enough. 8's just right, and 8's not too much.
Health experts say everything you take has potential for a side effect or bad reaction if you're not careful.
In other words, taking one medicine has its own risk factors. Taking 2 medicines has their own unique risk factors, but if the side effects are the same, there is theoretically an increase both in intensity and frequency of that side effect.
And remember, always review and look at your options with a health expert before taking more than one medication at a time. There could be other options that'll help you accomplish your same health goals. For this week's Ask the Expert, I'm Kelsey O'Donnell.
Doctors say you can decrease your chances of having to be on multiple different medications, ultimately by sustaining a lifestyle throughout your life. Remember, you can submit a health topic for our Ask the Expert series. Just head to our website, click the News tab, then Ask the Expert.